So welcome everyone. As you may have guessed, I am not Elisa Seeger. My name is Miranda McAuliffe. I am here on behalf of the ALD Alliance today. And I would also like to share with you all that I am a newborn screen parent. And I just want to say that it's been such a pleasure to tune in today and see all the advancements that have been made and the community that's come together since my son was born and first diagnosed almost 5 years ago. I've really enjoyed it. So thank you to ALD Connect and the sponsors for making this possible for me and for the Alliance. So Elisa apologizes that she could not be here today. I do assist her with the needs of the Alliance. For those of you that don't know the history of the foundation, also known as the Aiden Jack Seeger Foundation, Elisa lost her son to this disease back in 2012. His name was Aiden. He was only 7 years old. Elisa spent approximately 10 months in the hospital at his bedside. And as you can imagine any parent would do going through that, she searched this disease and was shocked to find out that there was a test for it and no one was utilizing it. So she made a promise to Aiden that no other boy would go through what he went through and what they went through as a family. And that became her mission. And she continues to fight today. And thanks to her efforts, my son, Jack, was diagnosed, like I said, almost 5 years ago, thanks to Aiden's Law being passed in 2013. So fast forward now to 2020. This is the current situation, as they say. I know the state count has come into question a couple times today, but we are currently at 20 states plus DC that are testing since Aiden's Law was signed in 2013. I think it's amazing and wonderful that during this crazy year, some states have been able to come on board and begin testing. So Georgia started in July of this year. New Hampshire began testing on August 26th of 2020. A big thanks to Grady and the Smith family, who I know put in a lot of work in that state to make that happen. And most recently, Utah started testing in September 20th of 2020. And also a thank you to Dr. Brunkowski. I know Elisa was working with you guys as well on that. So you can imagine COVID has been a huge obstacle for these newborn screening labs. So Maryland, due to a hiring freeze, has been delayed. Virginia was supposed to start this summer. But of course, due to COVID, there has been a delay. And some good recent news out of Missouri, they are expected to start testing in February of 2021. And we have to thank Julie Parsk and the Knockout ALD family for helping to make that happen. So these are the most recent numbers we have as of June 2020. I know Elisa tries not to bother the labs too much, but we do love getting these numbers in. And there have been 223 males diagnosed with ALD via newborn screening, also 202 female ALD carriers, 58 with Zellweger disease, and 15 other babies that were picked up for other diseases thanks to this newborn screening test. So Elisa added this quote into this presentation: whether you think you can or you can't, either way you are right. And I think what she was getting at here is, as you can imagine, this is a very slow climb, having to go state by state to get this passed. And it just shouldn't be. She says it all the time. It's a broken system. And it's ridiculous that a child's zip code, depending on the zip code they were born in, will determine their access to this diagnosis, monitoring, and of course, treatment if it's needed. It just shouldn't be, and this should be absolutely screened for on a federal level. So just to talk a little bit about where we are in the legislative world. That first bullet point stands for the Newborn Screening Saves Lives Reauthorization. So that really is the big federal push for this. Unfortunately, that has stalled in the Senate. Just a little bit of a background on that. Our biggest obstacle there is some questions surrounding the storage of the dried blood spot cards from the newborn screening test. So for those of you that aren't familiar with the way it works, obviously a baby is screened at birth, so the baby gets a little heel prick, the blood drop goes onto the card and then is sent to the labs for screening. What a lot of people don't realize is that that blood spot card has a life beyond that initial screening, and it's really detrimental to public health. Those cards in storage are used later on to validate equipment in the newborn screening labs. And then as other diseases come down the pipeline for testing, it's those cards that are used to perfect the tests so that they can be implemented. So they're so important. And Senator Rand Paul has introduced the idea of kind of an informed consent model where basically he and others would want to see that every parent is giving consent for these blood spots to be stored, even though they're de-identified. You know, there's no way to know who they're coming from. And I think in a perfect world, that would be ideal. But those of you that were following our social media pages in September Newborn Screening Awareness Month, we were talking a lot about this. It just represents so many challenges. For one, it's extremely costly. It can cause to an underrepresentation of certain demographic groups. And I think any woman on here that has given birth will tell you that right after delivery is probably not the best time to be asking for this type of consent, where you have to do so much education and explain what is involved. So that is the reason for the stall there. We have offered kind of our own meet in the middle ways, you know, maybe doing like an opt-out, but that remains to be seen, you know, what will happen there. So the good news is we sort of have found a way to circumvent this stalling in the Senate. And it's another initiative that she's been working on with two gentlemen from Matrofen. I'm not sure if they're on today. Their names are Ben and Chris. So if they are, thank you. I know they've been super helpful with this initiative. And that is the introduction of appropriations language. And that's something that would have to go through both the House and the Senate. And that would allow for funding for all diseases that are currently on the RUSP, which is the Recommended Uniform Screening Panel. And ALD is one of those diseases, also MPS 1, Pompe, and SMA. Currently, only 6 states are screening for all RUSP conditions. So this did go through the House already. I'm going to show you, so 2 of our local congressional representatives, Lee Zeldin and Yvette Clark, did introduce a Dear Colleague letter in the House asking all the representatives to sign on to this initiative. And we got 12, as you can see here. When I posted this on Facebook, Kathleen from ALD Connect had made the comment how nice it was to see that it was so bipartisan. And it definitely is, especially in a year like this. It was nice to see. So, you know, hopefully we see that in the Senate as well. And this is to ensure that all states are RUSP compliant by 2025. Now, we did ask, I believe it was for 15 million, but you can see here, this was the actual language. The committee includes an increase of 2 million to further these efforts. And this would be funding that would come from the CDC. And even though this still has to go through the Senate, I can tell you Elisa has already had 2 pretty lengthy, helpful phone calls with the CDC. So it's unprecedented and it's exciting. So hopefully that's something to look forward to. So the Senate is currently looking through this appropriations language. Again, local to us, Senator Gillibrand has been very helpful and has said that she will do everything she can. We would very much, how we had in the House, like to have a Republican counterpart to help push this through. So if anybody knows anybody, our contact info will be at the end of this slide. We could use all the help we can get. Okay, and just other things that are going on with the Alliance. So this is a Parent's Guide to Living with ALD. This was introduced at our last Standard of Care conference in January of this year. This was really 6 years in the making. So as soon as Elisa, started hearing from parents that were diagnosed through newborn screening, she realized that they were going to need a roadmap. I think it was Sharon that had mentioned on the patient panel we heard from earlier today that 4 or 5 years ago, 6, 7 years ago, all we could really do was Google and try to assemble our team. And unfortunately, it really led to some horror stories with the information that was out there at that time on the internet. So Elisa made this another mission of hers, and it's an amazing document. It's a collaboration between clinicians, the newborn screening labs, and newborn screening parents. And again, the goal is just to have a roadmap for these parents. As soon as they get this diagnosis of their baby, they know what needs to be done and what monitoring needs to occur. The project was funded through an educational grant from Bluebird Bio and ALD Connect, so thank you to them. And thank you to many of the clinicians that participated in this conference today that helped establish these guidelines and put it in a way so that, you know, those of us who don't have the medical background could understand it, particularly Dr. Malak, who I know did a lot of the editing work with Elisa. You can reach out to us if you would like this mailed to you. It's like a 30-page document. We'd be happy to send it to you. But I do also want to mention it is now a live document on the website on your screen, www.aldnewbornscreening.org. So at the end of today, you can go to that, and that might be a better route just to get the most up-to-date information, especially in terms of like contact information for our ALD experts. That's going to have the most current information as compared to the brochure. And this is just some feedback from some of our parents who received the brochure. So this is from Lauren Wilson in Tennessee. It's so much easier to read and understand, helps calm fears compared to Googling information. I actually mailed mine to a friend's daughter who did a project on ALD for her science class. As a middle school student, it was even easy for her to understand. And this is from Sarah Tong in Massachusetts. If I was given this up front, I would have seen the hope. I would have understood newborn screening isn't a crystal ball into seeing how my son would die. Instead, I was seeing the opportunity for preventative measures taken to potentially save my son's life. I would have seen the community instead of empty words on the internet. And that's exactly our hope. You know, I went through that myself. There wasn't much good to be found Googling this 5 years ago. So hopefully now that this guide exists and with the help of a little search engine optimization, this will be the thing that pops up first, we hope. Quick plug, we do have our annual standard of care meeting coming up the same weekend. It's always done in January. Of course, it will be virtual. So it'll be that Thursday and Friday, the 14th and 15th. We will be doing another family day on the Saturday. We have some really fun things planned for the kids. So stay tuned for that. We hope you'll join us. And the labs, we will be doing the meeting on the 13th, the day before, and we will be sending information out about that very soon. If you'd like to register, you can go to our website and do so. The link is right there. And that's some of our ALD families, and that's Aiden, the reason I'm here today. And this is our contact information. Oh, and I just added a Canada contact, just, you know, listening today. I saw at least twice in the chat that people were inquiring about what's going on in Canada. I have to be honest, I don't know myself too much, but I have been in touch with Kirsten Finn through social media. I know she's been reaching out to some of the labs in different provinces. So for those of you, like I saw at least two that were asking. I just asked her permission a few moments ago if I could put her email address, and she said yes. So please reach out to her. Okay, and I think that's it from me. I know awards are going to be starting in about a minute. So let me see if there's any. Do you have an update on when North Carolina will start newborn screening? So I don't, let's see, I'm gonna answer live. I don't have any specific dates for that state. I do believe they're blue on our map, which means there have been efforts starting, but please reach out to me personally, Miranda@aldalliance.org, if you think you can help in any way. Thank you. Okay, it's 4:30. Thank you so much. I know there's some awards to be given out. Again, first and foremost, as a newborn screen parent, I've really appreciated this today, and I'm looking forward to tomorrow.